sting at all? No. So, young lady, I'm going to ask you just to scoot yourself towards my hand. Slide your naughty out towards me. A little bit more. Keep going. You can do it. You can do it. There you go. A little more. One more scooch. Yeah, perfect.
Are you comfortable, dear?
Yeah.
All right. Perfect. Everything looks absolutely great. You're great. You know, you'll have no pain with this. You might feel a little pressure, but it's nothing that you can't handle. You feel all right there?
Okay, Dr. Ann.
Everything looks great. I'm going to give you a little target there. I'm going to separate your eyelids. That's all I'm going to do right now. You see Steve's finger?
Mm-hmm.
Keep looking at it. Very good. Suction on.
Perfect.
Excellent. You're doing beautifully. Just going to turn your head to the side of here. A little less light on that.
Yes, sir.
Okay, let's line that up if we can. That's good. She's on. This will reapply. Yep. Yeah, bring it down.
Perfect.
All right, lights out there. So this is the flap maker. Now I'm just going to line up the flap maker, the interlace. I'm going to feel a little pressure. Okay, it's perfect. All right, that's good. You look great. Excellent.
You are all set, Marano. Perfect.
We're going to make the flap now. These are air bubbles, actually, that are making the flap. So there's no blade, there's no cutting. You're doing great. A few more seconds and your flap will be made. And you're all done. So the flap is made in the right eye. This does not treat the prescription, but this is what makes the flap for the Lasik. This is actually one of the most important parts for your procedure. You did absolutely beautifully, dear. We'll put a little teardrop refresh in that eye. So you're doing beautifully. How are you feeling?
Good.
Excellent.
Furthest to your left.
I'm just going to take this off your left eye now. Sue's going to give you some lubricating drop, just 1 or 2 drops in the right. This just lets this eye relax for a little bit while I make the flap in the other eye. I'm going to give you a little numbing medicine in the left eye. We'll tape close the right eye. And this just rests now while we make the flap in the other eye. Now, dear, I'm just going to have you look straight up at Steve's finger. I'm going to separate your eyelids a little bit. You see his finger? Excellent. Suction on. You're doing great there. Just going to turn your head to the side. Excellent. Beautiful. So the same drill here. We just line this up. Perfect. Excellent.
Good there? 9mm.
Looks great, yeah.
Excellent.
All right, dear, just stay real still. This flap is made in 20 seconds. We have a few more seconds to go. You're doing absolutely beautifully. 6 more seconds. Very nice. Your flaps are made, and you're doing great. Take a little deep breath now and relax. Take the tape off here. And now we're going to get you set up to do the actual laser vision correction. So now we're going to swing her to a different laser, which is the Vuzix Star laser. And this is the laser that does the correction for her actual prescription. The prescription is up here, and it tells us how many seconds it's going to be. It's going to be a 20-second treatment at 49 micron depth. She's about a -3. This is the custom view with the automatic infrared tracking device for her. So there really is no better way than this to correct someone's prescription with a laser. You can open your eye now. Now, do you see a blinking light? Excellent. You see these little bubbles, and that is from the laser that made the flap. You see your lashes. I'm going to separate your lashes now, dear. You have a little wet cell sponge, please. The wet one's good. I'm going to clean off the lash here a little bit. I'm going to separate your eyelashes and lid a little bit with a little instrument called a speculum. Do you see the blinking light there? Mm-hmm. Just try to look at the blinking light as best you can. It's maybe a little bright for you. Do you see it now? I'm just going to line you up so that that looks great. So I'm just going to dry up the area a little bit. So this is the flap right here. Looks like a little button. So now I'll take a little instrument and go right to the edge of the flap. I'll go underneath that area. I'll probably lift it with the other one as well. So now this is the part where we get the name Lasik, where I'll lift the flap. There's a hinge which keeps it in space. I'm going to fold this down. I'll put this back after the laser vision correction. So now we're lining up the laser. Do you see the blinking light there? Mm-hmm. Excellent. You're doing beautifully.
1 sec. 1 sec. Excellent. And we have my
You're all set.
And lock. 2-0.
The laser treatment is now beginning. That's that little snapping sound you hear. You're doing beautifully, dear. Absolutely great.
10.
A few more seconds and your laser treatment will be completed.
It's complete.
You've been fabulous. This eye laser treatment has been made. And now what I'm going to do is put this flap back. Just the way it was when it was made. You'll see there's no sutures here. I'm just irrigating underneath it, just cooling off the area of the bed. The bed is the area that's below the flap. And I'm happy to say that your right eye is completely done and looks absolutely beautiful. These little red dots are just for the suction. Those will go away if you see them right here. Your eye looks beautiful. You can see how beautifully the white line goes right around this flap, and you see that it's absolutely perfectly back in position. I will give her some goggles to sleep with tonight. We'll see her tomorrow. Just letting this flap go back into place. It looks absolutely gorgeous. You're going to have a great result. Now I'm going to slowly take out this lid separator. Just look straight ahead here. Just relax. Good. Now just close your eyes. You're doing beautifully. So the right eye is complete. You're doing beautifully. It's almost done. How do you feel? Good. Excellent. All right, we're going to just put a little tape on the right eye gently. There you go. Thank you, Susan. We're going to take the tape off the left eye, and now we're going to do the same thing for your left eye. And you're going to have a perfect result. Now, your vision right now is going to be blurry. I put a ton of drops on you. And it really takes a few hours before your vision starts to improve. By tomorrow morning, you'll be able to drive without glasses or contact lenses. Your old prescription is no longer necessary. You no longer need contact. Excellent. You've done absolutely beautifully. I'm very happy for you. We're going to let you sit up now. We're all set. And now we'll hear from the star. How do you feel?
Good.
Okay. I'm going to help you up.
Okay.
I'm just going to let you sit up now. I got your back and your neck. You okay? You can slowly, I've got the back. You can slowly open your eyes. And you can look over that gentleman over the camera or the clock to your right.
Smile, you're on camera.
There you go.
Wow.
Can you see the time?
About the
You see the clock up there?
Yeah.
Excellent.
2 minutes to 7.
That's perfect. That's great.
It's only going to get
Well,
better.
it's going to get better and better every few hours. By tomorrow morning, it's going to be spectacular. It is our pleasure. Give you some of these. There you go. Just don't rub the eyes, so we'll rub along here. And I'm going to take you to another room and just take a look at your eyes and make sure I'm happy with the way they look.
Okay.
So I'm going to help you come down.
Get out of the way for a
There
moment.
you go. Take your time.
Oh, you know something?
Okay. All right, now we'll smile together. There you go.
Click, click.
Click.
Thank you. All right.
Thank you.
Come on this way.